And hello, Stacey. Thank you so much for being a part of the Copper Conscious Cookbook webinar.
Thank you, Carolyn, for having me and for the Wilson's Disease Foundation for putting so much time and effort into a wonderful cookbook that has been published just recently.
Already we've talked about so many things, and now we are getting to the topic of special attention for families, for pediatric nutrition. As you know, this is more important than ever with more young people, infants, children, toddlers being diagnosed with Wilson disease. What do you find is perhaps one of the most frequently asked questions when parents first see you as a registered dietitian for help following a special diet?
Yeah, I think it's kind of a very interesting perspective. We are seeing so many more diagnoses at an early age. And I think it's really important and critical when they are diagnosed at an early age that we're really considering not being too restrictive because of how important growth and development is in these kids. And we really do not want to encourage copper deficiency because it is so critical to bone growth. In terms of what families are wanting and asking for, I think they really are wanting to make sure they can have a cohesive family with a new diagnosis. Food is such a huge part of all of our lives. And so they want to make sure that that child is included with the rest of the family.
It's interesting. Every single parent, and you're a mother of two, has to deal with the picky eater or somebody who wants to do this and wants to do that. In your case, when you're counseling families, I can't imagine there's that extra stress for families who say, no, you can't have that because. How do you help parents and caregivers approach those questions from kids? Or maybe they're too small to even speak.
Well, I think it's really amazing what this cookbook and guidebook is really going to provide to these families, giving them the ability to have substitutions that are practical. For example, some kids who maybe are diagnosed at a younger age and are very sad about inability to have chocolate, for example, introducing carob trips early on or using the recipes that are provided in the cookbook to make a cookie that includes a carob chip or a muffin that includes a carob chip. I think that is kind of a good example of a substitute that can make those kids feel included without having to feel too restricted.
And grocery shopping, of course, is a family event often, and sometimes that responsibility falls into different members of the family. How do you think the cookbook really helps with planning, meal planning?
Yeah, I think it really opens up some recipes and ideas for families in order to make sure that the patient and the family is being included, but also by dividing it into categories of things of low, medium, and high foods. It really allows the family to focus on those low foods when they are grocery shopping based on categories. So when you are shopping at the grocery store, you do have that opportunity to pick the lower items on a regular basis.
Uh, Can you give us some examples of successes, maybe with families in terms of where they come in and they're just so stressed out and they think, "Oh my gosh, this is going to be really, really hard. It's hard enough being a parent." Kind of help us see how a registered dietitian support can really help.
And I think it's just normalizing meal times. I think that's really the big thing for families. Another thing that's super helpful to families is for them to do actually a few days of a dietary recall and really see how many items within their normal daily routine really do contain copper because many times there's not a ton of them, and if there is one or two items as a registered dietitian, when you do have that opportunity to meet one-on-one with those families, you can be an assistance to them to provide those substitute items. So I think the initial reaction is feeling overwhelmed, but I think by being able to speak with a registered dietitian, especially at a center of excellence, or even being able to refer families to this cookbook in the future, I think is really going to be amazing for these families to kind of be at ease that this is going to be okay, and they will be able to get through this.
All right. Now, everybody loves snacks. Okay. And we address that in the Copper Conscious Cookbook, of course. And thank you for your help on that chapter. The Copper Conscious Snack Guide is included in the cookbook. And that includes some examples of things like what could be every day, because, right, you're picking from the low copper content, and then moderate. Let's just jump to how much copper you should ideally have in a snack and why moderate? Why is that important to add a little bit of leeway there in snacking?
So I think one thing that we really need to keep an eye on is we do not want patients to become too copper deficient. So I think in the early stages when you are being diagnosed, starting various types of medications or treatment, many times we are a little bit stricter But at the same time, if you are being treated to remove copper from your body, you want to make sure you're still getting some within your diet. So the majority of snacks should really have less than 0.15 milligrams of copper per serving. And when it comes to the moderate things, we really shouldn't exceed about zero point 0.3 milligrams per serving of a snack. It's really those things that people are scared of eating, like peanut butter, hummus, and avocado, pumpkin seeds, for example, that really in the appropriate portion sizes and occasionally, I definitely think they should be able to be included. And so in my mind, I call them, we call them moderate in our book, but I call them to some of my patients are sometimes foods. And so I really try to make those types of things in the moderate category, not completely foreign to these families, but really something that they can enjoy.
Well, thank you so much. And another page in the book, folks, is a mix and match snack chart. So you can pick something from the very important, as I learned from Stacey, for that perfect snack, something perhaps some fruit and vegetables, some from a carbohydrate, and some from protein. Again, having a balance, not just a snack, it really is giving good nutrition. Thank you so much, Stacey. Can't wait to hear what you offer us up next in the world of kids and families, and of course, snacking.
Thank you, Carolyn.